I'm Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Urology and Multispeciality Hospital, Bengaluru. Today, I'll be discussing about a very common problem that everyone faces and we see regularly in our OPD, that is erectile dysfunction. Erectile dysfunction is a problem where the male is unable to get an erection, or even if he gets an erection, it will be weak and not good enough for penetration. It also includes situations where the penetration is successful but he cannot maintain the penetration and loses rigidity. These are the conditions which come under the category of erectile dysfunction. Now, the common question that is asked to me is it related to food? What are the causes for erectile dysfunction and what can be done? Erectile dysfunction is because of the decreased blood supply to the penis. Because a normal erection needs an adequate blood supply, and if for any reason, if the blood supply to the penis reduces, it causes erectile dysfunction. The causes are many. Food is not a direct cause for erectile dysfunction unless the person is malnourished or is suffering from severe nutritional deficiencies where the food assumes an important role. But for a normal person who is on normal diet, food doesn't affect erection too much. Therefore, there is no specific food which improves erection. However, people with erectile dysfunction are advised to eat food with high nutritional value, for example, proteins, vitamins, antioxidants, etc. But other than that, there is no specific type of food that improves erectile dysfunction. As far as the second query is concerned, what is the treatment for erectile dysfunction? Erectile dysfunction, before we talk of the treatment, we should know the causes. Many young people come to me with erectile dysfunction, and in them, almost always the cause is psychological, that is stress, anxiety, etc. We rarely find any physical problems in the youngsters. So what are these causes? It could be a job-related stress, it could be an interpersonal problem, it could be financial stress, it could be lack of privacy, etc. The stress need to be overt, in the sense it's not always at a conscious level. Sometimes even a subconscious stress can cause erectile dysfunction. For example, an IT professional who comes home with the laptop and he has got some leftover work to do and he has to finish in his home, it is considered as stress, and that also leads to erectile dysfunction. So once we identify psychological causes in the youngsters, we tell them to deal with stress by techniques like mind relaxation technique, some yoga, meditation, etc. We usually don't do any special tests, and these methods work along with some drugs which we give to improve the blood supply to the penis, which I think everyone knows. They are commonly called, go by the molecular name of seldenafil, tadalfil, etc. So this drug, along with lifestyle modification and stress modification, helps these youngsters. However, when the person who comes with erectile dysfunction is old, for example 60s or so, and they have got diabetes, hypertension, cholesterol problems, etc., then we also have to treat those factors because they are responsible for erectile dysfunction. They, along with the drugs that I spoke, do help in treating erectile dysfunction in both the groups. So, to put it in a nutshell, drugs or tablets form a mainstay in the treatment of erectile dysfunction, along with some lifestyle modifications like treatment of stress in the young, and also treatment of comorbidities like diabetes, cholesterol, hypertension in the elderly. So in a nutshell, this is the management for erectile dysfunction.